Things you should know about bipolar disorder. Bipolar disorder is a mental illness that affects a person's mood and energy levels. Everyone has highs and lows, but people with bipolar have extreme up and downs in mood. These mood changes can be distressing for them and other people. They can affect how they live their life, and even put them in risky situations. Between these mood swings, however, they feel and act normally. People with bipolar disorder have times when their highs are extreme and they have too much energy. These highs are called mania when severe, or hypermania when less severe. Most people with bipolar disorder also have times when they feel extremely down. They can feel hopeless, helpless, or empty. This is called bipolar depression. In the past, bipolar disorder was called manic depression. Bipolar disorder is a lifelong condition, but with the right treatment the symptoms can be well controlled. Before moving any further, if you are new to this channel, please subscribe and press on the bell icon. Types of bipolar disorder. There are two types of bipolar disorder: bipolar I disorder and bipolar II disorder. People with bipolar I disorder have mania, and most also have depression. People with bipolar II disorder have hypermania and depression. Doctors use these categories to help them choose the right treatment. What causes bipolar disorder? There is no single cause of bipolar disorder. It can be caused by different things in different people. We know that bipolar disorder changes how the brain works, and this causes symptoms of mental illness. Some things that make it more likely that someone will develop bipolar disorder are having particular genes, stress while a child or teenager, for example trauma or illness, using drugs. There is still a lot about the causes of bipolar disorder that isn't yet well understood. When someone already has bipolar disorder, their symptoms can be brought on by stress. Who gets bipolar disorder? Around 1 in every 100 people will have bipolar disorder during their life. It is seen in males and females, and in all countries and cultures. For people with bipolar I, symptoms usually begin during their late teens, with depression. For bipolar II, symptoms tend to start later, when the person is in their late 20s. Symptoms of bipolar disorder. People with bipolar disorder have extreme highs, which are mania or hypermania, and most also have lows, which are bipolar depression. Different people have these in different combinations. For example, people can have mostly mania, hypermania, mostly depression, depression followed by mania, hypermania, features of both at the same time. Between these mood swings, however, they feel and act normally. People with bipolar disorder usually have depression for much more of the time than they have mania or hypermania. Bipolar is different for everyone, but a common pattern is that someone will have at least one episode of bipolar symptoms every few years, with each episode lasting for a few months. Some people have rapid cycling bipolar, which means they have at least 4 episodes per year. How is bipolar disorder diagnosed? Bipolar disorder is diagnosed based on a person's symptoms and behavior. The diagnosis is usually made by a psychiatrist. Some clinical psychologists can also diagnose bipolar disorder. To make a diagnosis, a doctor needs to spend time with the person so they can understand them and their symptoms. The doctor may not make a diagnosis right away. Sometimes they might want to see how the person goes over time, before making a diagnosis. A medical checkup and tests are needed to make sure the symptoms are not caused by other medical conditions. How is bipolar disorder treated? Treatments for bipolar disorder include medications for mania, hypermania and depression, medication to stop symptoms returning, psychological treatments. In some circumstances, electroconvulsive therapy might be recommended. You and your healthcare team will work together to find the treatment that works best for you. Prevention. There's no sure way to prevent bipolar disorder. However, getting treatment at the earliest sign of a mental health disorder can help prevent bipolar disorder or other mental health conditions from worsening. Pay attention to warning signs. Addressing symptoms early on can prevent episodes from getting worse. You may have identified a pattern to your bipolar episodes and what triggers them. Call your doctor if you feel you're falling into an episode of depression or mania. Involve family members or friends in watching for warning signs. Avoid drugs and alcohol. Using alcohol or recreational drugs can worsen your symptoms and make them more likely to come back. Take your medications exactly as directed. You may be tempted to stop treatment, but don't. Stopping your medication or reducing your dose on your own may cause withdrawal effects, or your symptoms may worsen or return. Many people with bipolar disorder are still highly functioning individuals and can maintain a healthy professional and personal life. Untreated bipolar disorder is more likely to worsen and interfere with your daily life. If you know any facts about bipolar personality, please feel free to mention in comment section below. Thanks for watching.